Hello, thank you for joining us today for our first episode of our virtual Lunch and Learn. I am Sierra Endicott, and I am our Ironwood support coordinator here at Ironwood Cancer Research Centers. I have been working with patients since 2013 here at Ironwood in various support roles, and I am so happy to have the opportunity to present today. If you are wanting to view this episode or any of our other episodes for our virtual Lunch and Learn, please feel free to visit our new virtual library online, and you could view this episode, like I said, or any others. So we will get the presentation started. Our presentation today is on what are the supportive care services we offer in our supportive care services department. So we will begin now. In this presentation, we will view a few things here. I will introduce you to the Supportive Care Services Department and the purpose of the services that we offer here in the department. I'll introduce you to all of our supportive care services, team members, and the roles they play. We'll review the supportive care assistance that we do offer patients, or we'll review some of them. We offer an abundance of supportive care assistance. We'll review supportive care classes that we offer currently, and those are ever changing. We'll offer our therapeutic support, or we'll review our therapeutic support services that we have available, additional services that we have available for patients and caregivers. And then finally, we'll review how to find additional information on all of these services for patients, caregivers, and then those in the community who are interested. So first, we are going to highlight in this presentation what are supportive care services. Supportive care services here at Ironwood are comprehensive. It's a comprehensive approach towards patient care. The supports we have in place here are for the patients to address their physical and their mental and their emotional well-being for the patient during and after their treatment. Ironwood provides a robust support care service offering. We have an integrative oncologist, Dr. Heidi Rula. We have 2 genetic counselors, 2 registered dietitians, as well as 2 social workers. Some of the support therapies we have available for our patients are acupuncture, lymphatic massage therapy. We do have physical therapy for our patients, facials and skincare. Those are just a few to name. And most of those are offered in-house for our patients as a convenience. We also do have cancer support groups, chair yoga classes, painting classes, Tai Chi classes, heartfulness meditation classes, and we're continually adding to our calendar here for our patients to ensure that we are optimizing our classes and making them new and convenient for our patients to access. We have patient enrichment classes that are offered here at Ironwood in person or virtually. Currently, they're offered virtually, but we involve a lot of our physicians as well as our supportive care service team members. That way, our patients are receiving education regularly on how to best be empowered during their journey with cancer. We offer with boutique services. Currently, they're closed due to COVID precautions, but we do provide resources out into the community, and scarves and hats. All of that kind of stuff is available once the precautions are lifted. So we do provide guidance on financial assistance, and we do have our very own food pantries available in many, if not all, of our locations, so that patients can access the necessities that they need while going through treatment and even after treatment. So I want to introduce you to our supportive care services team. These people are a dedicated team that is here for our patients to consult and provide care for our patients in all phases of their cancer journey. So to begin with, Dr. Heidi Rula is our integrative oncologist as well as our medical director of the Supportive Care Services Department. She provides evidence-based complementary therapies that support conventional cancer treatment. She's there to help reduce the side effects, improve emotional, physical well-being, and optimize the health and healing process. So she's there to help with whole patient care or whole patient treatment. So she's treating mind, body, spirit sort of treatment towards the patient, not just the medical side of things. She is there to provide support, as I said, for whole person health. She can address topics such as coping strategies for anxiety and depression. She can assist with side effects of treatment, such as nausea, neuropathy, hot flashes, dry mouth, or to name a few. Those things are common side effects of chemotherapy, radiation therapy. She also assists in restoring health after cancer treatment is complete. So she works with patients in their survivorship phase of treatment, or in their survivorship phase of the journey, excuse me. He works in developing new lifestyle behaviors that can decrease the reoccurrence of cancer once again. So healthy diet habits, exercise, healthy exercise routines and regimens. So she's there for all of that. Those who are best suited for consultations with Dr. Rula and will benefit the most from those consultations will be patients who are looking to combine complementary therapies along with their chemotherapy, radiation therapy, or surgery treatments that they're already going through. Patients who are having difficulty, as I said, with their cancer treatments and they're experiencing, just neuropathy, nausea, those side effects that are just really day-to-day affecting their quality of life. She can offer some alternative treatments if they are not wanting to take, the route of typical medications. So she can offer supplements as options to those side effects. Patients who need additional support recovering from their cancer treatment, she can assist. Patients who need additional help with sexual health during and after treatment. Many patients will find that during their cancer survivorship that chemotherapy may have affected that. So she can assist with that. Yep, as I said, during patients' cancer survivorship, she can continue to provide that physical and emotional support that patients who are in their survivorship phase need. Next, we have another branch of our supportive care services, which is genetic counseling. This would be, we have Mandy Cass, who is on our west and east side, also our north side of the valley, as well as Rachel Matterhouse, who works on the east side of the valley for our patients. Both of these genetic counselors work with patients with a family history of cancer. Patients who would benefit from seeing both of our genetic counselor benefit from seeing our genetic counselors, would be patients younger than 50 years of age that have been diagnosed with cancer. Also, patients with one or more kind of cancers, rare cancer types, patients who have had a family member that has been identified with a genetic mutation, or patients who have questions about genetics and cancer. Our counselors are very happy to share their knowledge with patients to help them understand that component of their treatment journey. We also have 2 registered dietitians on staff. We have Kendra Peterson, who works in the West and North Valley, and we have Kara Bieber, who is in our East Valley. They work on consultations for patients of all types, but they work closely with patients with head and neck cancers, as well as pancreatic and stomach cancers. They also work closely with patients who are on tube feeding or ostomy patients who are in need of supplies, who need assistance with their education on these two things, and frankly, who have caregivers who need education with some of these items as well. So they assist with that, and they will often meet with patients in the chemo rooms to help them with that. They also will meet with patients who are dependent on supplements for their sole source of nutrition. They will assess them for the proper supplements to ensure they're getting the best nutrition. Patients who are experiencing a hard time swallowing, that's a concern for their clinical staff, and so they'll address that. Patients who want to begin a healthier lifestyle, that's not just only patients going through current treatment, but patients who are survivors of cancer and who just want to ensure that there's not a reoccurrence of cancer, and so they want to ensure they're on the right track. Patients with a body mass index of less than 18.5 or even below, or those who have lost significant weight during treatment, that's a concern for our physicians as well as our nursing staff. And so our dietitians will go meet with these patients and consult with them and see how they can ensure that they are gaining weight and maintaining weight during their treatment so that they can best get through that in a healthy way. And of course, patients who are referred based on clinical judgment by their oncologist or by their nurse, they're going to go ahead and meet with that patient and assess what that patient needs. And they'll meet with the family or caregivers as well and ensure that they're educated. So next we have two social workers as well on our staff. We have Jessica Wells, who's in our East Valley, and then we have Nicole McAllister, who is in the North and West Valley. Both of our social workers provide a tremendous amount of support for our patients who are facing barriers to their care. They provide counseling related to their cancer diagnosis. They will provide caregiver support services as well. We do offer a caregiver support groups for those who are seeking out specific caregiver support. We do offer, the social workers offer advanced directive services. So for those who are looking for assistance on filling out their living will or power of attorney, medical power of attorney, both Jessica and Nicole can assist with that. We offer smoking cessation education in the social work department, as well as a variety of cancer support groups. We have cancer-specific groups, as well as general cancer groups. Right now, most of those are virtual, but at some point they will be moving to in-person once again, I imagine. As I mentioned, they resolve quite a few barriers that many of our patients experience while going through cancer. Transportation to and from their appointments, food assistance with their grocery bills or with simple hygiene items they can assist with, foundation assistance. Many patients aren't aware that they have cancer-specific assistance out there. We will have one of our episodes specifically narrowing in on that and the financial assistance that foundations do offer to patients who are currently in treatment. For instance, the Lymphoma Society, as an example, will offer patients support with their cost of living to offset treatment costs. So social work can go ahead and narrow in on that, tell you requirements, and help you submit that paperwork. So that is a huge load that they can assist you with. As I mentioned earlier, we have wig boutiques in, I believe, our larger locations. So Chandler, Glendale, and Scottsdale. And in those wig boutiques, we provide scarves, hats, and every oncology patient is free to have one wig of their choice. So we are hoping to get those wig boutiques back open as soon as we are able to. So currently, we don't want to leave patients hanging though, and we want to provide the best resources we can. So we are providing resources out into the community who can support that need right now. So we also help with Social Security disability applications, and that is specific to each patient. So that requires sitting down with a social worker and seeing what their requirements are. We will review access information with patients. We can initiate applications and follow up with you if you have any questions. We offer assistance with referrals to caregiving services. Many patients find that they're too weak to take care of their in-home, daily living activities. So we offer resources in the community that can help you with that. So for instance, Arizona Long-Term Care, we can initiate that application for our patients and their family. We offer palliative or hospice referrals upon request. That's something that social workers can sit down with the family and the patient and speak about, and as well as the physician. So it's a whole care team discussion that everybody can have, and our social workers specifically meet with these palliative teams and ensure that they are providing our patients with the best care and the most up-to-date services, so we are familiar with whatever our patients are going to need and not just offering them whatever is out there. So, and then we have supportive care coordination. So that would be Grace Corbin. She is the medical assistant to Dr. Rula, and she does all of Dr. Rula's scheduling of new consults as well as follow-up visits with Dr. Rula. She fields all of the questions that patients may have for Dr. Rula, and she deals with all of that communication between Dr. Rula and her patients. So she is a great resource for any questions that you may have in relation to Dr. Rula, her scheduling, her supplements, or anything of that sort. And then, of course, there's myself, and I help with the implementation of services here for our patients and classes. I also work with community supports so that we can bring in community members as well as donors who can bring in supplies and care packages for our patients. So anything that is going to help our patients get through treatment easier. And then I also act as a volunteer coordinator. Unfortunately, our volunteers are not here right now. We miss them so much, but once things clear up with the virus, as I keep saying, we hope to have them back. We miss them so much. They work so hard in our boutiques and in our chemo rooms, saying hi to our patients, delivering warm blankets and treats. And so we hope to see them soon. Next, we're going to review the supportive care assistance. What services can we assist you with before, during, and after your treatment? As I mentioned during the social work slide, there are quite a few barriers to treatment that you don't realize you have until you're in treatment and you're facing these things. People don't plan to be sick, and these things often sneak up on people. Transportation to and from their treatment. People feel sick, they're not able to drive, they shouldn't be driving after treatment, or they don't have family and friends that are available during the treatment time to drive them. So we assist with finding companies that can assist them with transportation, and oftentimes people will be surprised, as for instance, Medicaid will provide free transportation to and from their appointments. So access plans, typically you call the number on the back of the card and they will provide that transportation. So social work, once again, I'm hopping back to them, they can assist with that. Again, we initiate the access application process for our patients. We don't want you to be uninsured and have that big burden on your chest of worrying about the cost of treatment when you need to be concentrating on how you can get through treatment and heal during your journey. So we often, as I mentioned, Social Security, disability benefits, we can help you through that application and process if you are somebody who would qualify for that. We help with the food and grocery assistance, counseling, grief counseling, resources for the community, and just navigating through this whole process that is very overwhelming and just can take a toll on caregivers, the patient, family, and friends. Next, we are going to go over the supportive care classes that are available to patients and assist patients with their physical and mental health during treatment. So what classes do we offer to you during your journey to wellness? We currently have a watercolor art class that is going on, and we have someone who is currently pre-recorded teaching those art classes, and people just really enjoy that. It's just a way to, an outlet, a creative outlet, a very calming outlet. So many of our patients who choose not to go to supportive groups because that's just not the way that they feel that they need to let go, they choose to go to our classes, and that's a great alternative. We do have low impact exercise classes, for instance, chair yoga, which helps mind, body, spirit. We have heartfulness meditation. It is a silent meditation, but it works on really just letting go of any judgments and just being in the moment and being mindful. So that is a very helpful. Many of our patients find all of these classes very helpful during their journey. We work on Tai Chi, which has, or we have a Tai Chi class, excuse me, that is very beneficial for multiple things, not only for the mind and the body, but it helps with balance. It's been known to help with neuropathy. So we have that class offered virtually currently, but it does go back to a physical class at some point. All of our classes are going to be on a calendar that is located at Ironwood, www.ironwoodcrc.com. If you go under the tab that has a actual calendar icon and download the printable calendar, it'll look something like the one here on the screen, and it'll be color coded by office. And then it'll show you the days and the times of our various classes as well as our support groups. So if you have any questions around if a class is going to be occurring that month, or if it's going to be canceled due to maybe a holiday, or you just want to know what the class is about or the support group, you can go ahead and give us a call at our support group or our supportive care services number at 480-314-6660, and you will likely get me, and I will go ahead and explain any of our classes to you. I have tried mostly all of them myself, and you can also email wellness@ironwoodcrc.com, and we can give you additional information as well. We are always adding classes and support groups based on what our patients need, so please feel free to check back. Currently, this is our virtual cancer support group list. We have 2 breast cancer support groups, and when I say we have 2, they're on different days and times so that we can try to reach more patients and at a more convenient time for patients. So we also have a caregiver support group that is on Saturdays, or on a Saturday, excuse me, We only allow caregivers in that group just because it is a time that caregivers need to have some time alone to, speak on their own and be able to relate to other caregivers. We have a colorectal cancer support group, a general cancer support group. So if you don't fall into one of these other specific cancer support groups, we don't want you to feel as though there's nothing here for you. There are 3 general cancer support groups with different days and times that we would love for you to attend. A prostate cancer support group, metastatic cancer support group, as well as the survivors group. So just because you're not going through cancer, we don't want to think that you can't, or don't want you to think that you cannot attend one of these groups. I always like to say that these patients in these support groups are patients who are newly diagnosed, they're in the middle of treatment, and they're the patients who are coming out of treatment at times, or they're just patients who just, once you're in the cancer group, you know what it's like to go through it. And so these are the people that are going to be able to give you good perspective and be a good support to you. So I really recommend these groups to you guys, and please take advantage of them. Next, we're going to review some therapeutic support group services. Our therapeutic services help to support the physical needs during patient's cancer treatment journey. The services we offer are provided in the Ironwood Cancer Research Centers, or the majority are, and they're offered at a reduced cost to patients. Our first one that I'm presenting here is acupuncture, and Dr. Xu and Dr. Wang are the physicians that are our acupuncture physicians, and they are with Meridian Pain Management. So acupuncture is a wonderful practice that can help provide relief for common cancer side effects such as nausea, vomiting. It can reduce edema from surgeries, normal cancer treatment and medications, pain reduction. It can help to improve your sleep, boost appetite, reduce hot flashes. And many of our patients have reported significant relief of their neuropathy after receiving acupuncture treatments. So if you are interested in receiving treatment, it's typically offered in Chandler and Scottsdale. I know Dr. Xu is currently offering treatments to patients in their Scottsdale office at this time. So please feel free to give them a call at the number shown, and they will go ahead and get you guys scheduled. Next, we have our oncology massage offerings. We have Janelle with Sunstone Massage and Bodywork, and then we have Rocco with Nobody's Perfect Massage. They are both certified and trained in oncology massage therapy. They massage soft tissue, deep tissue, and they are trained in lymphatic drainage, which is very beneficial while you're going through treatment. You must have an order from your physician to receive this treatment, as it can interfere with your treatment. So that's something you definitely want to touch base with your oncology or oncologist about. Rocco is in the Scottsdale office, and we have Janelle, who typically is in our Gilbert and Chandler 2 office. The benefits of massage are, abundant. We have chronic pain management. Of course, it's relaxing. Everybody knows that. It helps to decrease nausea, helps with neuropathy, increases your energy level, and then it does, of course, help sleep as well. We then have physical therapy. Many of our patients see our therapist, Karen Bastillo, for lymphedema. Many of our breast cancer patients, they will see her post-surgery or post-surgical, and they will see her for just many issues that they're experiencing after after or during their cancer treatment. So she works out of both the Gilbert and the Chandler 2 office. So for any of the appointments you can schedule with her personally at the number here on the screen. Next, we have Anne, who is our esthetician. She's an oncology esthetician. She works with patients who are experiencing skin changes during or even after their treatment, and she helps to help educate on products to use and avoid during treatment. She helps with informing patients how to draw in their eyebrows when they, may lose their eyebrows due to chemotherapy. She can help, with the lashes when you may lose your lashes during treatment. So if that's something that's concerning for you, she can address those things. She does do facials and she does do free consultations. So if that's something that you are interested in, please contact Anne at Mindful Skin Spa for scheduling and additional information. You can contact her there at the 480-390-2264. We also have two ladies who come into our Chandler 2 office, Barbara and Susie, and they work with Barbara's Mastectomy Boutique, and they fit many of our breast cancer patients with post-mastectomy bras and camisoles, as well as swimwear. For those who have elected not to have reconstructive surgery, this is a great service for you, as well as those who are in that waiting period before they are going to have their reconstructive surgery. So they bring in numerous styles of camisoles, as I said, and slips, and they can also fit you for breast forms and shapers as well. So there's many alternatives to reconstructive surgery. So these ladies do make appointments out of the home, as well as schedule you to be seen at the Chandler 2 location as well. We do have additional supportive care services that may not have been mentioned. I did mention the wig boutiques, so I mentioned that a few times actually. We do refer to outside assistance agencies. For instance, we do have some agencies that do help with patients who have children, and they help to assist with, paying for services for your children while you're going through cancer treatment. We do have services available that you may not know about. So those are things you need to address with your social worker or your dietitian to see what's available to you. We provide grief support referrals. If that's a counselor outside of Ironwood, or even grief support groups, we can provide that as well. There are patient enrichment courses that are available outside of Ironwood that are available or linked to Ironwood even, that we may have a physician or one of our team members speaking at, and we will let you guys know about. We offer a fantastic class for parents and children. It's called CLIMB, which is Children's Lives Include Moments of Bravery. It's a support group that is for, as I said, children and parents. It's for parents who have cancer. They will meet and have dinner for the night together, and then they will provide an activity for the children that aligns with the parents, and they will meet for a children's support group while the parents are meeting for their support group, and they can provide some insight for the children as to what's going on with their parents' treatment, but at an appropriate level for those children. So it's a fun group for the kids. They often have pizza and get to decorate t-shirts, and there's a lot of support there from the other children and as well as the other parents. So that's one of our offerings that we have. It does happen a few times of the year, so check back and see when we have that group. So we are here for you. So we're here as a resource. We have an abundance of resources. We are here to treat the patient as a whole, not just cancer. We want to treat you guys mind, body, soul. We want to treat you and help you with any barriers you may have. If you need support, physically, mentally, or emotionally. That is what we are here for. So if there is a resource that you want to know more about that is here, by all means, please reach out to us by email or phone or stop in at our Chandler 2 location where we are mainly at. But also, we all want you to feel as though you can let us know if there's not a support that is here, and we can provide that for you. So thank you so much for joining me today, for our supportive care services presentation. Next week on Tuesday at 11, we are live with Terry King for her presentation on what you should know as a patient at Ironwood Cancer Research Centers. So please join us for that. If you want to rewatch this video, once again, please check it out on our website in our virtual library, and you can view that once again. Thank you so much.